My patient had 4 miscarriages in a row. Every test had come back normal. Chromosomes, hormones, anatomy, literally everything. Then we discovered her immune system was attacking her pregnancies. There are a few simple blood tests that could have caught this years earlier. Hi, I'm Dr. Omatma, the holistic fertility doctor, and for nearly 20 years, I've been helping couples understand the complex factors that affect their fertility and pregnancy success. Up to 20% of recurrent pregnancy loss is caused by immune factors that most doctors never test for. Today, I'm sharing the immune factors that could be sabotaging your pregnancies and the tests that can help to identify them. The information in this video is educational only. This is not medical advice because I am not your personal doctor. I am a doctor, but I'm not your doctor. I'm just a random girl on YouTube. So let's get into it, but use this as education. And at the end, I will share some questions that you should talk to about with your doctor so that you can get more information and better support through this process. Recurrent pregnancy loss is defined as 2 or more consecutive pregnancy losses before 20 weeks. It affects about 1 to 2 couples that are trying to conceive, but for those experiencing it, the emotional toll is devastating. What many people don't realize is that pregnancy presents a unique immunological challenge. Your immune system's job is to attack foreign invaders, but during pregnancy, it must learn to tolerate the developing baby, which is genetically half foreign to your body. This delicate balance can sometimes go wrong. When your immune system becomes overactive or misdirected, it can interfere with implantation, placental development, and or the development of the pregnancy itself. The frustrating part is that standard pregnancy loss workups often miss these immune factors entirely, leaving couples with unexplained recurrent loss when there are actually identifiable things that are often easy to address if we know what they are. Pregnancy has sometimes been called the immunological paradox. During a healthy pregnancy, the immune system shifts towards an immune tolerance through specialized regulatory T cells that increase to protect the pregnancy. Research in human reproduction has shown that immune dysfunction contributes to about 20% of recurrent pregnancy losses. What's particularly important is that these immune issues often don't prevent conception, they prevent pregnancy maintenance. This is why so many women with immune-related pregnancy losses often conceive easily, but struggle with recurrent loss. The key immune players in pregnancy loss are as follows. Natural killer cells. These natural killer cells normally help fight infections and potentially cancer. However, when overactive, they can attack the developing pregnancy. Research in human reproduction found that women with recurrent pregnancy loss often had higher levels of NK cell activity compared to women with successful pregnancies. NK cell activity was elevated in 44% of the women with unexplained recurrent loss. NK cells can affect trophoblast cells that form the placenta, disrupt implantation, and can interfere with blood vessel development that's necessary for a healthy pregnancy. Testing involves simple blood tests measuring both NK cell percentages and activities. When normal levels are 5 to 15% of total lymphocytes, women with recurrent loss often show levels above 18 to 20%. Treatment includes immunomodulating medications like low-dose aspirin or heparin and natural approaches like omega-3 fatty acids, which research shows can help regulate NK cell activity. The second big factor is autoimmune antibodies. Several autoimmune antibodies have been linked to pregnancy loss. Anti-phospholipid antibodies interfere with blood clotting and placental blood flow. Research in the Lancet found that antibodies cause 90% pregnancy loss rates without treatment, dropping to 20% with appropriate therapy. Thyroid antibodies is another category that often comes up in regards to recurrent pregnancy loss, particularly antibodies like TPO or thyroid peroxidase antibody, as well as TGA, the thyroglobulin antibodies. often increase miscarriage risk 2 to 4 times when thyroid hormone levels are normal. A meta-analysis in human reproduction confirmed this connection. Anti-nuclear antibodies can also affect pregnancy outcomes with certain patterns associated with increased loss rates. Testing involves specific blood tests, ideally done before attempting pregnancy or in between pregnancies. The treatment for antibodies can often be low-dose aspirin, heparin, or corticosteroids, depending on the types of antibodies present. Alternatively, the more holistic approach often involves low-dose naltrexone, which works extremely well in studies as well as in human bodies that have shown increased rates of conception and pregnancy maintenance in women that previously had issues. The last factor is Th1, Th2 immune balance. The immune system has different response types. The Th1 response, which is inflammatory and infection fighting, and Th2 response, which is the tolerant pregnancy supportive type. Research in clinical and developmental immunology found that women with recurrent loss maintain Th1 dominant responses when they should shift to a Th2 dominant response during pregnancy. This imbalance can be influenced by chronic stress, infections, and inflammatory conditions. Natural approaches to support Th2 dominance include omega-3 fatty acids, vitamin D optimization, and stress reduction techniques. Last but not least, the gut-immune connection is very important to note. Your gut contains 70% of your immune system. Research in reproductive biology and endocrinology found that women with recurrent pregnancy loss had different gut bacteria, lower beneficial bacteria, and higher harmful bacteria. Leaky gut or intestinal permeability allows bacterial toxins and food particles to enter the bloodstream, triggering immune reactions. Food sensitivities can also create immune activation that interferes with pregnancy. Supporting gut health through anti-inflammatory diets, personalized for your own body type, increasing fermented foods, and introducing targeted probiotics can help modulate immune function and reduce disinflammation. Comprehensive testing should include NK cell testing, anti-phospholipid antibodies, thyroid antibodies, antinuclear antibodies, and Th1, Th2 ratios. Timing matters. Most of these tests should not be done when pregnant and ideally wait 3 months after a loss to even do this testing. Medical treatments include low-dose aspirin for anti-phospholipid antibodies, heparin for clotting disorders, and IVIG for severe NK cell elevation. The natural approaches include omega-3 fatty acids, vitamin D optimization, probiotics for gut health, stress reduction techniques, and anti-inflammatory diets. Many practitioners use integrative approaches combining both medical and natural treatments for optimal outcomes. Success rates are encouraging. Research shows that women with immune-related recurrent loss who receive appropriate therapies have a 70 to 80% live birth rate compared to those without treatment who have as low as 20% success. The red flags that suggest immune factors. Multiple early losses. If you have a pregnancy loss between 6 to 10 weeks and generally tend to have a loss between that time frame with normal chromosomal activity, then potentially immune factors are at play. History of autoimmune conditions, whether it's for yourself or a family member, is relevant. Chronic inflammatory conditions, digestive issues or food sensitivities, and frequent infections or slow healing time are all indicators that your immune system may be playing a role in your pregnancy outcomes. The questions to ask your doctor: can we test for immune factors in my losses? Should I see a reproductive immunologist? What immune tests do you recommend? And are there any natural approaches I can try alongside medical treatment? There is also, as I mentioned earlier, a very good alternative of low-dose naltrexone that a lot of doctors are using to support the immune system to be balanced through pregnancy. So ask the right questions and get the support that you need. Recurrent pregnancy loss is not the way that your fertility journey has to go. When to seek specialized care. If you've had 2 or more losses, especially with normal basic testing, consider immune evaluation. Don't wait for more losses. Early intervention often leads to better outcomes. The conclusion is your immune system plays a crucial role in pregnancy success, and immune dysfunction contributes to up to 20% of recurrent pregnancy loss. The key factors include NK cells, autoimmune antibodies, and Th1, Th2 balance, as well as gut health. The encouraging news is that immune-related pregnancy loss is often addressable well before a pregnancy loss happens. My patient that had 4 pregnancy losses, after identifying her Th1, Th2 imbalance and anti-phospholipid antibodies, we supported her with low-dose naltrexone and healing her gut lining, and she went on to have 2 healthy pregnancies afterwards. Your immune system doesn't have to be your enemy in pregnancy. With proper testing, treatment, and support, it can become an ally in creating and maintaining a healthy pregnancy. If you found this video useful, please give it a thumbs up and share it with someone who might find this info interesting. Remember, recurrent pregnancy loss is often not unexplained. It just needs the right testing and approach. You've got this. You can totally do it. Again, this is Dr. Omatma, the Holistic Fertility Doctor. If you need our support, our link is in the bio. Please feel free to contact us for more support and testing.